this is a big topic. As a matter of fact, people are using the term epidemics of myopia. And there's a significant amount of research that's going on, and there's just no way that I'm going to be able to cover this topic in 20 minutes. So I'm going to just kind of give a very general overview. My name is Donny Suh. I'm the chief and professor here at the Galvin Herbert Eye Institute. And first, I have no financial interest to disclose, and I would like to thank everyone for your support for the Galvin Herbert Eye Institute and so forth, and also for the UCI Health. My objective is to talk about what is myopia, and then we're going to talk about briefly the prevalence and causes, and then how do we manage it. And then my talk will be followed by Dr. Shlomit Radom-Aizik, and she will be talking about the importance of exercise and outdoor activities. So another term, the late term for myopia, is short-sightedness or nearsightedness. And basically what it means is that when the light hits the front part of the eye and it hits the lens, and that image or that light has to converge, as you can see on my mouse, converge on the back of the retina, which is the center of the retina called the macula. So everything has to come to that particular point for us to be able to see clearly. If that image does not converge in one point right at the macula, then you have blurred vision. So if the light hits the retina, then we call that a emetropia, means the patient has no refractive error. But if the light does not hit the back of the eye and it hits the front of the eye, then we call that myopia or nearsightedness. Now, if the light hits the back of the eye, then that's called farsightedness, which is a completely different topic. But we're going to mainly focus on nearsightedness or the myopia. All right. With a normal vision, you're going to be able to see things pretty clearly, both close and far away, as you can see here. If a patient has emetropia or normal vision, patient's going to be able to see the classrooms, the teachers. But if the patient has significant myopia, anything far away is going to be blurred. Now, what does that mean? So if the eyeball, if the light doesn't hit the macula, as we have talked about, right in the back of the eye, and if it's too close, then because of the growth of the eyeball, because the eyeball is growing too fast, then that will result in myopia. Now, that can result in potential problems. As you become more and more nearsighted, as the eyeball grows, that can cause straining on the eye, and which can result in retinal degeneration, or sometimes we use the medical term is a macular degeneration. And as more nearsighted you are, greater the risk of the macular degeneration. And also the retina, which is like the film in the back, as the eyeball grows, that's going to cause tension on the retina. And sometimes the retina can tear. It can detach from the back of the eye, resulting in retinal detachment, which is a devastating condition. And as you become more nearsighted, and as that retina is being pulled more and more, there's a greater risk of retinal detachment. And also there's an increased risk of glaucoma. Now, how do we quantify the nearsightedness? So if you're -1, that means that you can see anything up to about 3 feet. If you're -2, you can see about 1.5 feet away. And if you're -6, that's 7 inches. And if you're -10, you would have to keep things at 4 inches away. So longer the eyeball, closer you would have to hold the object to see clearly. Because anything beyond that focal point is going to be blurred. Now, what would be the symptoms of myopia? Of course, you're going to have blurred vision, anything that's at distance. You could only see things close. So that's going to cause squinting, straining, and headaches and things like that. And then what do kids do to solve that problem? They get closer. So this becomes almost like a vicious cycle. You are nearsighted, so you tend to get closer to things to see clearly. And And then you get closer and closer and closer to see more clearly. And that can result in worsening of the nearsightedness by making the eyeball grow, or it's called the axial length growth. So, but the important thing is that there are other things that can make the eyeball grow. For example, glaucomas, retinopathy, or prematurity. These are all medical conditions, can all result in the growth of the eyeball in abnormal fashion. And also there are different multi-system diseases like a Stickler's disease, diabetes, Marfan's. Other genetic disorders can result in growth of the eyeball. So these things have to be ruled out before we just simply say you're nearsighted. And also medications that people use for seizures, antibiotics, high blood pressures, muscle spasms. These things can also result in nearsightedness as well. So we have to do a complete ocular and medical history and complete eye examinations before we diagnose of someone of just having simple nearsightedness. Now, how big is this problem? It is big. It is, like I said, as I've alluded to earlier, this is considered almost an epidemic. By 2050, it is thought that over 50% of the population on Earth will be nearsighted because the rate has been increasing tremendously. And unfortunately, COVID made things worse, which I will talk about a little bit more. So what are the risk factors of myopia? What causes myopia? There are two components. There's a genetic component and there's an environmental factor, which Dr. Aizik will talk about. The genetic factor is the congenital, that's in your genes. It's a genomic pre-programmed. But there are things that we're doing, epigenetics, that were impacting those genes and related to the lifestyle that's making things worse. So it's a multifactorial. So for example, the genetic factors, if your mom and dad is nearsighted, then the child has 12-fold increase in chance of developing nearsightedness. So this is pretty significant. And environmental factor. So outdoor activities at outdoor time is highly consistent. So meaning less time you spend outdoor and not exposing yourself to the sun result in significant myopia. Near work, prolonged reading and writing and holding the things close and a prolonged use of electronic devices all result in myopia, and that's highly consistent. In terms of the physical activities, like types of sport, types of sleep, types of diet, and exposure to smoking have not been associated with a significant myopia. So reading time and reading distance, how important is this? There's a 2% increase in risk for every 1 hour more of near activity. So more prolonged activities of reading that will increase incrementally, that will increase your risk of myopia. So we're going to talk about the COVID a little bit. In the last 3 years, it was a pretty painful experience, but unfortunately for the growth of the eye, it actually had more detrimental impact. So during COVID, there was a significant reduce in outdoor time, and there was a significant increase in near activities. And a survey was performed, and we have found that there was a almost tenfold increase in near activities because most of the kids were locked inside and they were mostly reading and confined to near activities, and there wasn't much outdoor activities. And during this time, the estimated annual incidence of myopia prior to COVID was about 11%. There was an 11% increase, but during COVID, that rate had tripled to about 29.68%. And also the incidence of myopia, the degree of the myopia prior to COVID was about 0.41 diopters every year. But during the COVID, that number increased. So there was a dramatic increase in the amount of the nearsightedness to 0.8 diopters. And also axial growth. The eyeball grew faster during that shorter amount of time because of the prolonged activities of the near activities and also less outdoor activities. And so what are the things that we can do to slow down the progression of myopia. I'm going to tell you, there is actually extensive research that's going on around the world, including here at the Gavin Herbert Eye Institute. We collected the data from the iMobile program, and we were able to confirm some of these findings. And we found that increasing the outdoor time is important, and good reading habits and regular eye check is important. So what do I mean by that? Outdoor time. This particular study was performed in Taiwan, and what they did was that prior to mandating outdoor activities, there was a gradual progression of myopia. As you can see, there were just percentage of the kids becoming myopic was increasing every year, and this was something that was very concerning the Taiwanese educational department. And so what they did was that they implemented mandatory 2-hour day outdoor activities, and they found both in younger population and older population, they were able to retard or decrease the rate of the progression of myopia. So this, because of this study, and there were other studies that were performed, that we recommend kids spend at least 2 hours per day outside playing. And screen time. We recommend anyone in school, starting kindergarten, screen time outside of class to 2 hours of screen time for leisure. So that's what we recommend. So, when kids are reading, when kids are using their phones or iPads for leisure, I tell them, time yourself and be intentional. Don't just be navigating and just wasting time, but time yourself for 2 hours, and that's how much you're going to get. And so they can actually be more efficient and less waste less time. And then, how close should you hold your phone? For the phones, it is recommended about arm's length away, which is about 30 centimeters for the kids. And for iPads, it's about 40 centimeters, and then 50 centimeters for the computers. So desktop computers. So this is something you should try to measure when your kids are questioning, like, "Mom, how close should I hold the phone?" Get a tape measure and measure 30 centimeters. Okay. And lighting. Every 1,000 lux increase in average light intensity slows down the growth of the eyeball. So what does that mean? Indoor light that we have right here is about 100 lux. When you're outside, that number is about 100 times. It's a 10,000 lux. So obviously, there's a significant decrease in the amount of intensity of the light when you're indoor using light bulbs. So what I recommend is that try to avoid reading in the dark, because what that does is that when you're reading in the dark, you tend to hold closer, you see? So, and always have the table lamp plus indoor light. Have both lights on if possible, and try to read and write next to the window, and have to place a desk next to a brighter setting. Yes, there are medications available. I use a low-dose atropine, which actually has been very effective. So for those patients with a significant genetics component, even though they're trying the environmental lifestyle changes, but I see that there's a prolonged, there's a growth of the eyeball, and we can measure the length of the eyeball. And if I see progression of the axial length of the eyeball, despite the lifestyle changes, then medications are available, including the low-dose atropine. And there are different types of different concentrations that's available. And also optical method. There's a defocusing spectacles, and currently there are 3 out there, and they both all seem pretty promising, but none of them are FDA approved. And you can get those in Canada, in Turkey, and parts of Asia, parts of South America. But at this point, the verdict is still out, and it's not FDA approved. And I would recommend that we hold off on it as of right now. It's just more data that's coming out that's more convincing. Multifocal contact lenses, where these contact lenses, where they can focus both close and near. Various types of multifocal contact lenses available, and they are FDA approved, and those can be tried and used with the help of your optometrist. And of course, orthokeratology, which has been around for, I think it's almost 30 years now, I think, which reshapes the cornea. And so they would wear the contact lenses at nighttime, and then they would take it off, and then they would function throughout the day, and then they would replace place the contact lens again at nighttime. So of course, these patients need to be followed closely to make sure there's no corneal complications. So important suggestions: outdoor time, 2 hours a day, I would highly recommend. Then reading habits, follow the rule of 20-20-20, and everyone is talking about it, and which I fully recommend. Every 20 minutes, take 20 seconds off. So every 20 minutes, take 20 seconds a break and just close your eyes or look at something far away, at least 20 feet away. And this is not going to only help to slow down the progression of myopia, but it will help with the surface of the eye and make your eyes wetter. And then near activities of school, the phones and iPads, only 2 hours outside of schoolwork. And then there are medications that's available. Thank you very much for your time. And I'm going to have Dr. Isaac discuss the importance of the exercise. And so I'm going to stop sharing. And also, if you have questions, please place them in the comment section, and then I will try to address the questions as much as possible. So put it on the chat. Thank you.
Right.
Dr.
So good evening, everybody. My name is Shlomit Radom-Aizik, and I'm a professor in the Department of Pediatrics and the director of the UC Irvine Health Pediatric Exercise and Genomics Research Center. Dr. Suh, it's an honor for me to follow your presentation and to have the opportunity to share a little bit more information about physical activity and screen time with all of you today. So thank you for joining us. So what's the plan for today? This is part 2 of the talk. And what we prepared for you, we are planning to discuss a little bit about the impact of early life intervention on health across the lifespan. I'm going to share some information from the CDC, the Centers for Disease Control and Prevention, on health benefits of physical activity for children. We are going to explore how many of the kids in the United States are actually meet physical activity guidelines and how many meet the sedentary time or screen time recommendations. We'll elaborate a little bit about the effects of screen time on children's development, and we'll end up with a few tips for parents how to make a difference. So for us, all of us as parents, we should not think about our children as our mini us. And we should understand and remember that the roots of lifelong health are planted early on during childhood. Childhood is actually a critical period of growth and development, and it is characterized by rapid changes, many changes that are happening during this critical period, including physical growth, cognitive development, the brain is developing, emotional growth, and social skills development. All these changes collectively basically lay the foundation for good health across the lifespan. So this slide is a perfect example of the concept that I just shared with you, and it presents how movement behaviors early in life influences health across the lifespan. There is lots of data, evidence-based data from the literature that shows that physical activity, sedentary behavior, and sleep, those what we call 24-hour movement and non-movement behaviors, all of them play an important role in the children's growth and development. There is also evidence that a healthy child is likely to become a healthier adult. And this is actually true for the behavioral aspect as well, showing that lifestyle behavior that the children are picking up during their childhood actually goes with them into their adulthood life. So the message over here, and think about it, is very, very important. It actually pointed towards us as parents, as physicians, educators, caregivers, all of us. We truly need to make sure that we provide the children everything that they need to optimize their own development and to enter into adulthood at their very own best. This infographics was created by the CDC, and it actually listed the health benefits of physical activity for children. I'm sure that if I'm gonna explore how many of you believe that exercise is good for us, I hope I can see you, but I hope that you're all nodding, that you do agree that exercise is good for us, and it is good for any age group. However, I'd like us to focus in this infographics and understand the magnitude of the effect and the various health effects that exercise actually benefit. So if we look at aerobic fitness is the type of activity that increase the heart rate. Aerobic fitness improve heart and lung health. It improves the cardiometabolic health, helps maintain normal blood sugar. It reduces risk of chronic diseases like type 2 diabetes and obesity, help maintain healthy weight. It improves muscular strength and bone strength. And in recent years, there is more and more data to show the beneficial effects of exercise on actually the brain health, reduces risk of depression, improves attention and memory, and of course, when those are better, improves academic performance. For me, when I look at it, I actually, and this is a core concept in our center, that exercise is medicine. But I can actually think that this is much better than any medicine that we can find on the shelf. And for us, we just need to make sure that our kids are getting enough of this great medicine. Specifically, and I left out, but this is coming, we are going to talk a little bit more today about the health benefits of exercise on vision health. So how much of this medicine of our kids should get? There are physical activity guidelines for Americans, both for adults and for children. Those are different guidelines. Today, we are specifically focusing on children, and we'll start with the age group of 6 to 17 years old. And based on the United States recommendation, our children need to be engaged in at least 60 minutes of physical activity every day of the week. Okay, every day. And this activity should include aerobic activity, the one that increases heart rate, and at least 3 times a week. As part of this 60 minutes, it should include activities that increase muscle strengthening and bone strengthening activities. For the younger children, age 3 to 5, the recommendations are a bit different. As always, they are adjusted to their age and capabilities. The recommendations are for them to be physically active throughout the days. Their responsibilities on the adults. The adults should make sure to encourage the children to be active, to play, preferably outdoor. We'll talk about it a little bit later. And make the most, make a lot of effort to keep them active as much as we can. Every couple of years, there is a report that covers the United States physical activity report card on physical activity and screen time for children and youth. This report is actually, it looks like what you know, a standard grade from A to F, where A is that at least 80% of the children meet the specific guidelines. B is 60 to 79%, C 40 to 59%, D 20 to 39%, F, we don't want to get there, but this is there. And actually, I'd like you to take a moment and think for yourself, what do you think the percent of children in the United States that meet physical activity guidelines of 1 hour daily? I can say it, but it can actually be interesting if you can put it in the chat. But if not, just take a moment and think. And I'm just going to click and show you that the grade for 2022 is D minus. And basically what it means that only about 25% of the children in the United States, and of course this is an average, there are different a percentage in different age group, but in general, only 1 in 4 children meet physical activity recommendations of at least 60 minutes daily. How are we doing with, just to remember, here we go, another thing, just to remember, this is the concept that we talked before regarding behavioral stuff. Whatever our kids acquired during their childhood, they are going to continue into adulthood. Another reason why we should make an effort to encourage and promote physical activity with our children. Switching to sedentary behavior. Sedentary behavior is actually estimated by the time that the children spend in front of the screen time. And the indicator, as Dr. Suh mentioned in his talk, is that the recommendation is not to have more than 2 hours a day. This is excluding the time that they spend on their schoolwork. So again, take a moment and try to think what would be the grade for screen time for our kids in the United States. And again, the grade is D. We are not doing well, and there is more to that because 2 hours is the recommendation. But okay, so how much time our children are actually spending in front of the screens? So the CDC provided some data on that. And in general, on average, our children spend between 6 to 7 hours. Again, there are differences between different age groups, but between 6 to 7 hours of screen time, and this is excluding the schoolwork that they are doing. So there is lots of room for improvement, and this is actually a very good reason to be concerned. There is an increased there is an evidence, and there are a couple of studies, and I'm going to talk about them, that shows that increased screen time and low physical activity are directly associated with myopia. And I'm going to share with you the recent studies that just came out. So this study is a study from Copenhagen. It started in 2000. It's actually a prospective study. The participants were recruited at the very first day that they were born, and the researchers follow them during their childhood with many health assessments. One of the assessments was the vision health. It was around the age of 16 to 17. And the data that was collected on 1,443 adolescents, both male and females, boys and girls, the same thing, showed 25 prevalence of myopia. And what they show over there in the study is that being physically active more than 3 hours per week was associated in a 40% reduction in the odds for myopia. And I'm going to repeat it. What they show in this specific study, 40% reduction in the odds for myopia. They also show that the use of screen devices more than 6 hours a day almost doubled the odds of having myopia. Another study with younger children, 12 to 13 years old, showed actually similar results, And what they report is that physical activity was associated with lower estimated prevalence of myopia compared to children who were sedentary most of the time. I'd like now to take a couple of minutes just to elaborate on the effects of screen time on children's development in addition to the vision health. And I'd like to start with the effect on the brain. So too much time have an effect on attention, too much time in front of the screen, the electronic devices, have an effect on attention span, on memory, and learning abilities. All those can lower academic achievement. Taking and spending too much time in front of the screens actually takes away the time that the children can socialize and play with each other and interacting with friends, with families, with adults. All those are very, very important for their social development. Another effect of too much screen time is the delay in language development. Language development requires conversations, real conversations between human beings. Okay, so passive listening behind the screen cannot replace those conversations, and infants that spend too many hours in front of the screens are more likely to experience a language impairment later in the future. Lastly, I'd like to talk about sleep. And with the sleep, I'm not sure, Dr. Suh, that you mentioned the blue lights. You didn't mention them. So I'll just briefly mention that the blue light that emitted from the electronic devices may have an effect on sleep patterns. Now, sleep is important at any age. It's important for adults and for children. Specifically, it is very important for their health. Not enough sleep for children. This can lead to behavioral and learning problems, both at home and at school, of course. We have just a couple of more slides, and I'd like to summarize because we wanted to leave enough time for questions. So I'm going back, and I know that Dr. Suh already talked a little bit about the screen time recommendations. We are going to summarize it again and just complete this session with a full understanding what are the screen time recommendations. So for children under the age of 2, 0 screen time. There is no reason for them to be in front of the screen. Of course, this is if there is a video chatting with family, with friends, those are acceptable. But other than that, 0 time. Ages 2 to 5 years old, the recommendation is no more than 1 hour a day, and this hour also being recommended to be a co-viewing, if possible, with parents or with a sibling. For ages 5 or 6 and above, generally no more than 2 hours per day except for the homework. So what can we as parents do to promote physical activity and limit the screen time of our children? Number one, of course, it's limit screen time. And look over here, we specifically say limit and not eliminate. There is absolutely no intention to eliminate. We just want to limit the screen time, and preferably and more effectively, it's going to happen if we are going to create it as a routine. So set the daily limits on the screen, whether specific hours in the day from 4 to 6, in the afternoon, all electronic devices into the drawer, or whatever works for in your families with your kids, but limit screen time is super important. Number 2, encourage physical activity and preferably outdoor activity. You've heard from Dr. Suh how important it is, these outdoor exposures. We can combine both of those and promote both sports and physical activity as in the outdoors. Number 3, super important, model behavior. Okay? Remember, our kids do what they see, and we should actually practice what we preach. So parents should model an active lifestyle and limit their screen time. It's going to help our kids. It's going to help us. And the last one is, again, back to the routine, and just to emphasize how important routine is for children. Children need routine. So if we structure both the physical activity and screen time, that we limit the screen time as a routine, it will be much easier to follow and to make behavioral changes. So I'm going to stop here for us to have enough time for a question.
Thank you.
And just remember that it's us, the adults, who are responsible for taking care of our kids.
Shlomit, thank you very much. Gosh, I cannot overemphasize the importance of your talk today. I just love this holistic approach. Thank you, and please join us for the future upcoming lectures. We have some great lectures lined up for you, and thank you very much for all your support.